can see a few people in the waiting room starting to come through. Good evening, everyone. As you all probably know by now, we'll give it a couple of minutes just to let everybody join the room, and we'll go through a few introductions. What we always like to do for these sessions, if you want to put which uni you're from, what year, because we always find we've got people England, Wales, Scotland, so put your uni in your year, or if you're a foundation trainee or even qualified, just so we know who we're speaking to. It always takes somebody to be brave and be the first one to put it in. Queen's Uni, Northern Ireland. That's the first one I've seen in a long time. So thank you for joining us, second year as well. So really good to be sort of covering this session now, because it's going to be useful for your whole journey. So if you're in your final couple of years or foundation trainee, then this will be good for those that are really coming up and quite stressful situations. And if you're at the start of your journey, it's really good to give you those long-lasting skills for when you get to those situations. I'll give it just a couple more minutes because I think we're still waiting on a few more to join, and then we'll get underway with Melissa, who's going to be our first speaker for the evening. Okay, so I'm going to get started. So welcome everybody to tonight's webinar. So it's really amazing for you all to be here. I'm Alex, I'm the Vice President of BPSA. And tonight you've joined us for part of our mental health campaign. We've got two amazing speakers, Melissa from Pharmacist Support and Heidi from the RPS, who are going to be talking about different factors that really fit into our mental health. So whether you're here because you've experienced some types of stress, anxiety, or actually if you just want to get a better grounding on what we do and sort of how we can manage those strategies a bit more as well. So make yourself comfortable. We've got two amazing sessions, and we'll get started with Melissa. So I'll let you introduce yourself, Melissa, while I'm loading up your slides.
Right, thank you. Hi everyone, I'm Melissa Cochran, the Senior Wellbeing Development Officer at Pharmacist Support. Oh, sorry, I just gave my old title. I'm the Wellbeing Development Manager at Pharmacist Support. So in case you haven't met us before, Pharmacist Support is an independent charity, and we offer all kinds of services to those working and studying in pharmacy. So I'm hoping that you'll be inspired to check out our website to find out some more about the support that's available to you through us. So I'll be talking about that a little bit as we go through. But today we'll be talking about what you can do to help manage your worries, the science that underpins these practices. And I'm really excited to share with you information about how worry and stress impact our bodies and minds, and what we can do about it. Next slide, please. So I thought we'd start by looking at why this is important. According to the Center for Disease Control and Prevention in the United States, approximately 75% of all doctors' visits are in some way related to stress. Different researchers put the figure at slightly different places. Some put it as high as 90%, but it generally falls between 75 and 90%. Whatever the actual figure is, I find that statistic staggering. And the World Health Organization calls stress the health epidemic of the 21st century. And of course, they were calling it pre-pandemic. So now that we've all been through the pandemic, it's probably even stress and anxiety are probably even more prevalent than they were before. So we know that stress can contribute to issues such as headaches, high blood pressure, heart problems, diabetes, skin conditions, asthma, arthritis, depression, anxiety. The list goes on. And it's such a major issue for pharmacists and healthcare professionals, both in their own lives and also in caring for patients. And stress can drastically impact the quality of life for those who are experiencing it. Let's do the next slide, please.
If you bear with us a second, I believe we might be having some internet connections for Melissa. So Melissa will be back in 1 second to continue this. I think her internet has just dropped out. There we go. Yeah, as we all know, even after a couple of years in the pandemic, the Zoom is still always going to be a roll of the dice. So as for all of us, we'll hold fire a second and we'll see when Melissa joins us back. So actually, if you think about what Melissa's just said, how many of yourselves have had to have conversations either with lecturers or colleagues and friends about actually like the stress that you've had so far on your journey? And we'll cover more about some of those little tips and tricks that Melissa's going to go through when she does join us once more. So we'll wait 1 second for her and we'll go for there. Okay, it looks like she's must be having big internet problems. What we might have to do is if she's having trouble connecting, we're just going to have to swap it around a little bit. So we'll restart if Melissa joins back in a bit. But Heidi, are you all right if we swap over and start with yourselves, as I think Melissa's internet is catching up with her a bit?
Yeah, that's fine, no problem at all. I'll just share my slides. Let me just get them up. Okay. Okay, is that fine? Can you see the slides all right, the title slide?
It's just got the next slide ones on. If you go on the double, the 3 dots. There we go.
Oh, it's closed screen sharing. Let me try again. Okay. Is that okay now? Can you see that?
Yes, yeah, that's come through now, yeah.
And still?
Yeah, perfect.
Okay, good.
Thank you, Heidi.
Okay, so thank you for inviting me to speak tonight. So my name's Heidi Wright. I'm Practice and Policy Lead for England at the RPS. And I lead the Workforce Wellbeing Programme, and that's across England, Scotland and Wales. So although I work in the England team, Workforce Wellbeing obviously covers all 3 countries. So what I'll look at trying to cover this evening is a bit on why are we focusing on workforce wellbeing as RPS, look at some of the survey results we've had from 2021, have a bit of a discussion on the key issues and themes that have come out of the results from the surveys across all 3 years, but particularly the most recent one, and open it up obviously to questions. So any sort of concerns you have about what the future might hold in terms of workforce wellbeing and working as a pharmacist, and also what we're looking at doing next as RPS and potentially how you might want to get involved in that. Just to say a bit about RPS, I'm sure you know who we are, but obviously we are the representative body for pharmacists, the professional leadership body, and that's pharmacists working in all areas of practice. So not just looking at any particular sector, we go across all areas of practice. So as I'm going through the presentation tonight, some of the questions you can think about there is, you know, the survey results that I'm showing, does that reflect experiences that you've had? And that's experiences you might have had in work placements as well as during your study. And what are the biggest issues for you in terms of workforce wellbeing? And what would you like to see change, thinking about the kind of environments you might be going into in the future? And obviously, any positive examples, we're always looking for case studies. So if you've had a good experience of being supported through any issues with mental health and wellbeing, we're always really keen to hear those. Okay. Okay, sorry, I'm just having some technical issues by the looks of it as well. Let me just see. Okay, so looking at workforce wellbeing, we did an initial survey back in 2019. So I suppose we really started thinking about wellbeing and what was happening in terms of the pharmacy workforce in 2018. And it took us a while to pull a survey together and to start looking at that, what was happening in terms of the workforce and the mental health and wellbeing of the workforce. So the initial survey, as I said, was taken in 2019 to sort of get a baseline and assess what the situation was. We have continuously done the survey in collaboration with Pharmacist Support, and we've both committed to repeat this survey annually to see changes, whether they're positive or negative. We assess the impacts of the survey and we publish the findings. So the recent reports can be found on our website. And following the survey, we then advocate for change. And I'll talk about some of the successes we've had in terms of that as well. And we also work with other key stakeholders. This isn't just RPS and Pharmacist Support pulling stuff together. Depending on what comes out of the survey, we work with like NHS England, for example, GPHC, employers, various others to try and get change to happen on the ground. So how do we develop the survey? Well, we do a literature search every year. So obviously the first one was looking back at literature up until 2019. And then year on year, we look at other literature that's come out during the time of the previous survey. So 2019, as I said, was as based to form the basis of the survey. And we tend to use some of the questions, the same questions every year, but we also change some. So using the same ones, then obviously we can look at any changes and trends and patterns over the years. But we change some as well to reflect what's come out of the previous survey and areas that we might want to get a bit more in-depth insight into. When we develop the survey, we engage with obviously the board members at RPS, We use our locals to get engagement from members on the ground. We've got our expert advisory groups. We do engage with BPSA. And also we've got the ABCD group and the Workforce Wellbeing Action Group. And we do get engagement from other Royal Colleges who also look at this in terms of their workforce. And we develop it as a non-bias survey. So our research team help us in developing the survey. And this year, or last year, the last survey was open to RPS members and non-members. So it's not just RPS members who can fill it in. And we normally open it for 2 to 3 weeks. So we had it open from the 23rd of September to the 18th of October. So we did in 2021, we had just over 1,000 responses, and that's kind of reflective of what we'd had in the previous year's survey as well. I think we had 1,300 and something in the first year, and just under 1,000 in the second year, and just over 1,000, as I say, last year. 45% of the respondents in 2021 worked in community pharmacy, 26% in hospital, and 11% in general practice. And as you'd expect, the majority of respondents were from England. I think it's about 75%, and smaller numbers from Scotland and Wales. In terms of students who responded, because this is also open to pharmacy students, so only 46 of the 1,000 odd responses came from undergraduates. So obviously it's a very small number, so difficult to analyse results against that particular area of respondents. But we did notice that undergraduates did seem to be more aware of services that were available to support their mental health and well-being, and actually felt more comfortable in seeking support than perhaps some of the other members of RPS. So just to give you some of the survey results, 89% of respondents are at risk of burnout, and there's a particular Oldenburg inventory that we use, and that's used by others such as the medics as well to assess risk of burnout. It's the same percentage as we found in 2020, and it's higher than what it was in 2019. Reasons for this were given as inadequate staffing, long working hours, lack of work-life balance, no protected learning time or rest breaks, very little support. We did find that there was a higher risk of burnout amongst pharmacists who had been qualified for either 5 years or less than 5 years. And also a higher risk of burnout for those pharmacists who work in community pharmacy compared to hospital pharmacy or general practice. In terms of undergraduates, the burnout was lower at 72%, so that's good to see, but obviously still 72% is actually quite high. So burnout obviously has an impact not just on the individual, but also on the business, etc., because half of respondents that responded, they hadn't taken time off for sick leave, but actually 3 in 10 of respondents had wanted to take time off, but had not felt able to. So that's quite concerning as well, that people really wanted to have time off sick, but felt that they couldn't because of the pressures on them. So that's very concerning for us as well. So yeah, 99% of those respondents who said they wanted to take time off but couldn't were at the high risk of burnout, as you can imagine. So moving on, we looked at whether mental health and well-being or work had negatively affected mental health and well-being. And as you can see there, 68% of respondents reported that work had never negatively impacted their mental health and well-being. And again, similar sort of reasons such as workload, inadequate staffing, long hours, lack of work-life balance, lack of recognition actually came up in this one as well, and public expectations. So the public placing demands on the pharmacists. About 2 in 5 people said their mental health sometimes affected their ability to carry out their work effectively or accurately. And in terms of the undergraduates who responded, it comes across that they're not as negatively affected by their study as pharmacists who are actually out there employed at the moment. But over a third of respondents said that their overall mental health and well-being had been average in the last year. Well, 4 in 10 said it was poor or very poor. And compared to the results that we had from the previous year, there was an increase in the number of people who were reporting good or very good overall mental health and well-being. That had gone up by about 10%. So that was something positive that came out of the survey results. Those who have been qualified between 0 and 10 years had a higher level of very poor and lower levels of good overall mental health and well-being, which again is quite concerning. But 50% of respondents said that they did actually enjoy some aspects of their work, and 84% said they either really enjoyed or enjoyed some aspects of their work. So again, there are a few little positives in the results, although overall, obviously, they're not showing that pharmacists, well, they're showing that pharmacists are at high risk of burnout. Protected learning time was a new question that we put in the survey last year, but it's something that come out of previous surveys that people said that they weren't getting any protected learning time. So we wanted to dig into that a little bit more. And basically 2 in 5 people said they were not given any protected learning time at their place of work or study. And a further 2 in 5 were not given sufficient protected learning time, or they were only given time if it was mandatory organisational training rather than study that they felt they needed. And basically only 1 in 5 reported receiving any sufficient protected learning time. And again, it was more so in community pharmacy that pharmacists were feeling that they didn't get protected learning time, whereas 33% of those working in general practice said that they were given sufficient protected learning time. And that's probably the way that that's been set up at the moment, in that if you're employed by the PCN as a PCN pharmacist, there's automatically some protected learning time associated with that role. So again, rest breaks was something that we put in as a separate question in 2021, because it came out of previous surveys that people were not taking or not being offered rest breaks. And we found that although about 40% of people were offered rest breaks, they were not able to take them. And about 17% weren't actually offered a rest break at all, which is very concerning, because there's a lot of evidence that shows if you don't take rest breaks, you're more likely to make errors. So there's a patient safety issue here as well. And then looking at the profession as a whole, we were looking at what do people feel about their jobs, about the profession, and quite worryingly, around a third of respondents had considered leaving their current role. And even more worryingly, a third of respondents had considered leaving the profession. We didn't explore the reasons for this in this particular survey, but that's something we might look at in a bit more detail in this year's survey. Those who have been qualified for 5 years or less, there was a higher proportion who considered leaving the pharmacy profession. So 43% of that qualification range had thought of leaving the profession, which is worrying. But again, that was a small sample size. It is slightly higher than what we're seeing in the NHS staff surveys. The NHS staff survey from 2020 showed that 26.5% of NHS staff often thought about leaving their organisation. So what we're seeing in the pharmacy profession is slightly higher than that. And then these are the top factors that came through for poor mental health and well-being. So as I've mentioned before, inadequate staffing, lack of learning time, the long working hours and the lack of work-life balance, and the lack of colleague or senior support came through quite high as well. Obviously, COVID-19 pandemic highlighted some of the issues that were already there in the system. So COVID did put more pressure on pharmacists, but the issues were already there and they were really sort of amplified by the pandemic. So we've now got 3 years of data and we can look at that and analyse it. And the sort of basic messages are that, you know, pharmacy, like others in the NHS, we are at a high risk of burnout. There are environmental factors that are having an impact on mental health and well-being. And also there's something about pharmacists not being aware or not using the support that is available to them. So again, there's a lot of reasons as to why pharmacists might not want to access support, particularly if it's provided by their employer. But there is evidence that points towards poor working cultures, excessive workloads, etc., being key drivers of poor mental health and well-being and burnout. And in 2021, we did have more respondents aware of the mental health and wellbeing support that was available, but take-up of the service continues to be quite low. Some of the barriers that were talked about were lack of time to actually use services, concerns about confidentiality, and also potential impact on career. So if you sort of identified as having a mental health and wellbeing problem, there is still stigma attached to that, or people perceive that there is, and therefore they didn't want to identify themselves as having a mental health issue. But 4 in 5 respondents were aware of employer or NHS funded occupational services, but only 14% had accessed these services. And we still had about a fifth of respondents not aware of the services at all. Awareness tended to be lower for those working in community pharmacy. And as I said, some of the barriers that came out, and also one of the other things that came out was respondents felt that they should be able to manage without actually seeking help. So they should be able to deal with it themselves, being a professional. So that's something that came through as well. About 2/3 of the respondents said they would not feel comfortable accessing support from their employer, their university, or their place of work or study. And again, some of the issues around that were around confidentiality, the fact that what they say to employers could potentially be used against them. So again, there's this whole stigma still around mental health and well-being, and there's a lot of work that still needs to be done to overcome some of that. So what are we focusing on this year? So we've looked at all the data, and prevention is really one of the key areas. So we've had some successes in the past in terms of getting access to nationally funded support available through the NHS across all 3 countries. But one of the key things still is prevention. So we want to stop people getting to the stage where they're actually having to access support. So we're looking at protected learning time, and we're looking at rest breaks. Those seem to be some of the key areas that pharmacists are not getting rest breaks, and they're not getting protected learning time. I can't tell you exactly what we're doing in these areas because we're still working it out, but obviously advocacy is one of the main things that we do, and we will be advocating for pharmacists to get protected learning time and to have rest breaks, so to be offered them and to be able to take them. And also as an individual to understand the need to have a rest break and to take it if it is offered to you. So those are the key things we will be working on during 2022. Oh, sorry, it's not moving on. There we go. We continue obviously to work with pharmacist support, and we are providing some learning events with pharmacist support for our members across the year as well. We've established a workforce wellbeing action group, which is open to RPS members, and we get feedback from this group on some of the key areas that they think we should work on, and also they kind of act as a bit of a sounding board for some of the work we're doing around workforce wellbeing. We have developed and published, as you probably have seen, an RPS Inclusion and Wellbeing Pledge. And that covers obviously inclusion and diversity as well as workforce wellbeing. And one of the key things this year is to look at how that's being implemented across all different sectors, as individuals, as organisations, as teams, and sharing examples of good practice, because it's all well and good having a pledge that people sign up to, but then it's about how is that implemented in practice. We've also got an RPS Wellbeing Hub that's got a whole range of resources on it. It links across to the England, Scotland and Wales NHS pages, which again have got huge amounts of resources, and obviously links across to pharmacist support as well. And there's a couple of particular support resources that we've developed, which it's about building positive workplace relations and a support tool to help workforce wellbeing in the workplace, kind of almost like a little checklist. And then we try and demonstrate good practice by having blogs that are written by our members to say what they're doing, or how they've dealt with perhaps mental health and wellbeing issues. So as I said, these are our next steps. I won't read all those out, but our main task in this area really is advocacy. We will see if there's a need for resources and guidance that can help embed rest breaks and protected learning time. We will continue to look at destigmatization. That is still a big barrier to people accessing support. And we will work with pharmacist support and continue to signpost to the good materials that they have and the resources that they have too. And one of the other things that's come across, and more so during the pandemic, or probably been highlighted more during the pandemic, is abuse. And that's public abuse as of pharmacists, and again, particularly those working in community pharmacy. We did a lot of work at the start of the pandemic around that, worked with the Met Police, and they would increase their sort of visits to community pharmacies. But that is another thing that we are looking at, and we're part of NHS England group that is looking at how we can protect the professionals from abuse, and part of that's looking at public expectations as well. So that's it from me. Happy to take any questions, and would be good to hear some of your thoughts around what are your concerns, I guess, going out into the workplace around mental health and wellbeing, and what would you like to see in place to support you to make sure that you have a positive experience in terms of mental health and wellbeing. So I will just so you've got the information, but I think these slides will be shared later anyway, but there's some links to the campaigns, obviously to pharmacist support as well. And please do email if you want to afterwards. There's a workforce wellbeing at RFRMS email, which we have access to, and we can respond. So if you've got any queries or questions or things that you think of after tonight, then please do email us. So I will just stop sharing my slides.
Amazing. Thank you so much for going through that, Heidi. Now I've put a couple of those links in the chat. So the actual campaign on the workforce wellbeing and the pledge itself. So I know a few of you I've already messaged say you've had a look at those, or I've now opened those links. So I suppose while we're waiting for a few people to put any questions to Heidi, you can put them directly in the chat or the Q&A. Actually, sort of, Heidi, one of the big things is with saying that being students and going into the workplace, not necessarily an RPS point, but actually for your advice of going into practice, how do you put your best foot forward in that sense and get the most out of that foundation training year?
Yeah, I mean, it's difficult because things have changed since I was actually at that starting point, and you forget what it was like sometimes, and the pressures that you are under. And I think one of the things is to set boundaries early on, to make sure you do get your rest breaks. So it is really difficult, because as pharmacists, we do put the person in front of us, we put their needs before our needs. And it is really hard to say, no, I'm going to take a 20-minute break, or, you know, I'm just going to walk away for like 10, 15 minutes. I need that mental break as such. And even like in my role, I'm not patient facing, but if you have a deadline, you work through your lunch break because you need to get it done. And we're very bad at looking after our own mental health and well-being. So there is something about setting those boundaries from the start, and it's not necessarily an easy thing to do. You know, you want to impress your employer to a degree, but there is starting to be a change in the culture about employers recognizing, not that they don't allow people to have rest breaks, so I don't want it to come across like that, they do. You know, employers do offer pharmacists rest breaks, but it's about that whole culture and the understanding. And I think that's coming across more and more, not just in pharmacy practice, but in all practice as well. There's a lot more focus on mental health and well-being, probably because of the pandemic. And that's starting to come through in culture. So I think it is, yeah, as you go into the workplace, make sure you kind of set your boundaries and you know, say, I will be taking a rest break, I will be doing this. As I say, not easy, easier said than done probably, but.
No, that is really perfect. Sorry, I don't know why my connections came through like that. No, that was an amazing answer. Somebody said for a possible sort of next steps is having regular one-to-ones with a member of support staff would be really helpful. And I suppose that varies from workplace to workplace, but I suppose the highlight of that is finding more mechanisms of support within that organisation.
Yeah, and we've got a couple of the blogs that we've had members write for us talk about how they've managed to bring well-being into like the regular one-to-one meetings. And it's not just asking the question and expecting people to go on fine. It's having real conversations about mental health and well-being, and that has been really helpful. A lot of places now have mental health champions or mental health first aiders. A lot of pharmacists themselves actually are trained as mental health first aiders. So there is more understanding around it, I would say, than there has been previously. And yes, if you can find someone within the workplace that you feel comfortable talking to and having those kind of conversations with, then yeah, a great first step.
Brilliant. And with you saying about mental health first aiders, so it's something that BPSA has worked quite closely with. So pretty much all of our executive MHFA mental health first aid trained, and we've also done a lot with the schools. So I can even see a few lists of people that have participated in the first aid training from different unis from up and down the country. So I suppose another sort of aspect of that is if you go into an organisation for foundation training or when you're a pharmacist, how can you have the confidence to say to management to sort of encourage different support services to be available?
That is difficult. Yeah, it's a good question. It depends. I mean, to be honest, a lot of the larger employers do have that available. I think there is still this lack of wanting to use an employer-led service, and I can understand that. It's not just about confidence of using the service. It's about that lack of first of all, not wanting your employer to know that you're suffering as such from a mental health and well-being issue, and also if you do use it, will that impact further down the line on your career? Will it be a black mark against your name, sort of thing? So I think having nationally available services, support services, and obviously pharmacist support are brilliant, having that available for our profession, but also now having the NHS services available. They weren't until until 2020, those were not available to pharmacists. They were only funded for medics. So we've now got pharmacists and pharmacy team members as well. So it's not just the pharmacists who've got access to those. So that's a really good step forward, because that is, you don't have to then say to your employer, I have a problem and I need support. You can go and get that support elsewhere. Although you should feel comfortable enough, that's the other thing. The environment and the working culture should be that you should feel comfortable enough to be able to say to your employer, I have a mental health issue, and they should be supporting you through it. So, you know, there's two sides to that, but I don't think we're there yet across, well, from our survey results, we can see that people are not comfortable accessing employer provided support. So if your employer hasn't got support available, there are national schemes available, but it is worth having a conversation with them to say, you know, have you thought about, and again, actually the workforce wellbeing support resource, I can't remember exactly the title of it, but that we produced last year, that's helps you to think about some of the questions, and you can almost use that as a, oh look, this is what the RPS have put together. How does it apply to the place I'm working in, kind of thing, and go through it with your manager. And that might just raise a few little red flags and make them think about what they provide as well.
Amazing. I know, I think it's because I've got my monitor next to me that sometimes interferes. So I know I've been blasting you with lots of difficult questions as we're going through. I know we can't go through the full details of the work that's being done, but can you tell sort of our students actually what the Workforce Wellbeing Group, how they sort of go about making those adjustments from the survey?
Yeah, so the Workforce Wellbeing Action Group, so that's people, if you're an RPS member, you can sign up to that group. So we've got about 100 odd people signed up to it. We meet, last year we met every 2 months. This year we're going to meet every 3 months. And we have an evening Zoom meeting like this. We get about 30 to 40 people attend. So it's not like all 100 and however many come in one go, because that would be pretty impossible to manage. And we kind of open it up to them as to what they want to talk about. So we do use them in terms of developing the survey. So when we're at a stage where we've got a draft ready, we share it with them, we ask for their comments, we take those on board. We ask them, you know, are there any areas that we've missed completely, that things are happening out there on the ground. We use them when we develop like the support guidance, so the workforce wellbeing in the workplace resource, the building positive workplace relations, we use them. We also, members of the action group have developed the blogs. So that's something else they get involved in. You know, if they've got a good example, they talk about it, and then we're like, can you do a blog? Well, we help write the blogs, but yeah, so we use their good examples and share them, because I think that's when it makes it real, is when you talk about like when it's happening in practice. So the theory is all well and good, but unless you can show examples of where it works in practice. And then in terms of rest breaks and protected learning time, we had a discussion with the Workforce Wellbeing Action Group towards the end of last year about what they felt was working well or not working well in terms of rest breaks and protected learning time. And that's before we had the survey results come in. So we've got a little bit of insight into, you know, maybe there's some stuff around top tips about when to take your protected learning time and all this kind of thing that we can develop a bit further. But as we sort of develop the project plan as to what we're going to do around rest breaks and workforce wellbeing, we will engage with that group again. And sometimes it's in a meeting, depends, you know, when the work fits into when the meetings are. So our next meeting with that group isn't until May, so we'll probably have something earlier than that. So that will be shared via email with the group and to get their comments and feedback on. So they kind of influence and shape our project work that we do around workforce wellbeing as a whole.
Brilliant, thank you. And I think I might change my headphones after this one. But no, that is really good, because we often see these things, but knowing about the processes that go on behind closed doors in a way really helps sort of, I know myself have had a lot of reassurance from it, and I know a lot of you listening will also have that saying that there is a situation that is being adapted to, and it's a constant moving one. We all know with mental health, like there's been this big boom in actually how important it is, and that's something that's going to take time to go through. So thank you for your work in sort of leading that and encouraging this group. I've not got any more questions come in just now. If you've got any final questions for Heidi, we were meant to have Melissa from Pharmacy Support speaking, but as we found out earlier, there was some technical issues. So what we'll do is we'll rearrange that pharmacy support session, as it's really important. It was on stress, anxiety and exams. So we'll have a look at rearranging that because it's really important that everybody gets to see that. So just while waiting for some final questions, remember everybody can go to Pharmacy Support. So on there, not only is there lots of resources on anxiety, mental health, financial aids, there's also a student-specific hub. So it has tailored resources to students of any year, and there's also a foundation trainee hub on Pharmacy Support as well. So please have a look at some of those resources. They've been made in combination with students and Pharmacy Support, and there's lots of positive feedback about actually how useful they really are. So if you are having different states of mind with mental health, whether it is anxiety or you think there's something a bit more long-term that you need more support on, please reach out, because that's always the first step. And it doesn't matter if you're a student, foundation trainee, or you've been a qualified pharmacist, is reach out when you need help, because the more support you can get early on, the more help you get going through. So I can't see any final questions. I know we've really picked your brain on that one, Heidi.
No, I'm more than happy. And actually what you've just said, that came out in our last Workforce Wellbeing Action Group, that confidence to reach out. So we might be looking at what we can do around that. It's difficult because apart from saying to people, you can, it's hard to give people that confidence, but that's something we might be looking at in the next Workforce Wellbeing Action Group, that sort of confidence to reach out.
Perfect. Yes. Yeah. And I know lots of organisations, and it's been amazing to have you on, Heidi. Just before everybody, I know we finished this session a little bit earlier than planned, but we've just put a link into the chat. Basically, every year we try and support students by sharing experiences. So as Heidi said about the blogs that RPS have done, we like to do a similar thing. So there is that form for students to fill out, whether that you've had a positive or negative mental health experience. It's completely anonymous, but if you can highlight your story, and if you're happy for us to share that, then it might encourage another student that's having those similar experiences, sort of support and give them a bit of guidance on that as well. So that's on there. So if you are happy to use the form, please complete it, or drop myself an email. I'll put my email address in the chat now. But otherwise, I'll let everybody enjoy the rest of their evening. Thank you everyone for joining us. And again, thank you so much, Heidi, for giving your insight and your knowledge on this area.
No, and thanks for the opportunity.
No worries. Oh, I've just seen that somebody says the link doesn't work. Let me reuse the, I imagine that's for the form. So let me, while a few people are waiting for it, I'll just double check for them. What I'll do is, just because we're at the end of this, I'll, in the email that I'll send to you over the next few weeks, I'll include the links in there as well. So I'll send that through as soon as I can. So thank you all for this evening. Thank you again, Heidi, and continue to see what we're doing over the next few months and years and following this through. So thank you all, and I'll leave you to enjoy the rest of your Wednesday evening.
Thanks, bye.